Good afternoon, and many thanks to the Alumni Office and the Dean for inviting me to share a little bit about my journey to date, my career to date since I graduated from RCSI in 2000. I was from the class of 2000, very much enjoyed my time there, and I've had a fairly colorful career to date, lots of variety, lots of different experiences, and I'm here today to share with you some of those experiences. I might first show you a picture of my family. Introduce myself. That I'm Tommy, and most people call me Dr. Tun or Tommy Tun, although my first full surname is Jordan. My surname is Jordan, and I'm a consultant endocrinologist in Connolly Hospital. And this is my good wife, Christina, who's a pharmacist. But she's now a full-time mom minding two boys, Isaac and Benjamin. And that's a picture of Benjamin's first birthday in March, right in the middle of COVID. So I was born in Myanmar, or I used to refer to as Burma. And I then moved to Hong Kong quite quickly, only when I was about a year and a half. And I grew up there. And I suppose as with most people who had moved from Burma to a place like Hong Kong or elsewhere, a lot of us ended up being medics. And certainly me, my brother, and my sister were all essentially told that we would have to choose our careers as doctors. And that's what we did. And as we finished our A-levels, then I got a place here in RCSI. So from Hong Kong all the way halfway around the world, ended up in Ireland here. And, enjoyed my time there, and I'm proud to be part of this international community which RCSI represents. So I'm going to divide my talk into three sections, one being teaching, the next one being research, and the final one being leadership. And I'll go through each of the sections and, as I say, showcase, if you want to put it that way, some of the things that I've been involved in since I graduated. So I'm based here in Connolly, and I suppose the Connolly campus is the site for the year 2 of the graduate entry medicine program, the GEM program. And I have been involved in things like the open day, as well as, obviously teaching the students. But apart from teaching the GEM to students, we're also involved in teaching the senior cycle students, intermediate cycle students from the undergraduate program, as well as even the physician associates as well. And I've slowly built up a portfolio of different lectures and talks I've given over the years. I do consider myself a keen, enthusiastic teacher, educator, and so I take it upon myself to teach students every Friday lunchtime here, going through different various endocrine topics. And you see here a sample timetable of what it looks like, trying to cover the common topics that students, NCHDs will encounter during their time here in Connolly. And everyone's welcome. You don't have to be on the endocrine team to come here. My teaching experience extends beyond just students and medical students or other disciplines, but also includes patients. I'm a diabetologist, so I also very often get involved in teaching for Diabetes Ireland, as well as talks to GPs or other allied health professionals. And I enjoy it. Maybe you might say I like to talk too much. But so far, thankfully, I think the feedback I usually get from my talks are not too bad. I then I'll switch track and talk a bit about my research. I was delighted that I had an opportunity to do a PhD when I was in Tallaght Hospital. And I did my research and my PhD on cardiovascular risk in non-diabetes mellitus insulin-resistant states. That's basically just to say that, we looked at conditions such as metabolic syndrome, polycystic ovary syndrome, and looked at cardiovascular risks in there. And I had the pleasure to be able to, privilege to be able to collaborate with different study groups funded by the EU. LibGene was the main collaborator between UCD and at that time Tallaght University, and also had the opportunities to visit Queen's University to do some cell works there. The research continues here in Connolly Hospital. We are involved in various different things, including clinical trials with Professor Srinivasan as the main principal investigator, and then some also smaller scale original studies varying from different things like thyroid nodules to circadian rhythms and sleep and so forth. And I'm not an ultra high-end productive researcher, but I've managed to get about a modest 22 number of publications in my career to date. When I finished my PhD in 2011, and I had the opportunity to also take up a master's in leadership and health professions education. And I suppose it was a fantastic opportunity to then really get involved in, just learning more formally about education and about how education develops and research around that. And I took on for my own project and my dissertation to look at a little bit more into structured feedback within the GEM program. What we did was basically took the students when they had done their MCQs, we straight away gave them the feedback from the MCQs to see whether that was helpful ahead of feeding forward into their next assessment and MCQ. We also did feedback for their clinical exam. At the time we were using TOSCI, so in team-based clinical examination of the patient. And we did almost like a randomized trial where basically some of the groups got individual feedback and some of them got collective feedback, and just see what the differences are there. So I very much enjoyed my time as an educator and as well as a researcher. And then I'll come on to the third stream, which is also a big passion of mine, which is about leadership. So even I suppose when I was training as an SPR and so on, I was very, very heavily involved in the training program. I was part of the collegiate members committee. I worked very closely with the College of Physicians, RCPI, with regards to looking at ways of how to improve the training. We got access, we managed to get negotiated access for up to date for all the trainees. We laid the groundwork for ePortfolio. I finished my training by then, but it was launched then soon after that, as well as revamping some of the awards that the college had and to promote and to encourage trainees to get involved in things like research and publication. I'm also the intern tutor here in Connolly Hospital, and as part of that role, and includes as well one of the modules in the MSc in Leadership and Health Professions Education. We devised a handbook for supervisors, again to try to help with training of junior doctors. In this next slide, you will see that slides of some of the interns and Mr. Keeling, Mr. Parnell Keeling, and myself. These were just taken from last month when I took my role up, my position as an intern tutor here in Connolly Hospital to look after the interns. I set up the Keeling Intern Award, KIA for short, named after Mr. Keeling, who was my predecessor for the intern as an intern tutor. And my role there is to organize training, teaching for the interns, to mentor them, as well as to be the go-to person if there are issues with regards to training. So apart from that, then I was also involved in more kind of senior management level in a couple of things. The next slide shows this slide shows the at the time when we were trying to, as a hospital and a campus, to bid for the children's hospital, the new children's hospital for Ireland, and that's the architect's kind of impression of what it might look like if it was built here. And I think it would be very nice. The new building we do have, the Urgent Care Satellite Center, is also very nice. But I think it was good to be involved in that. And it's a shame that we didn't get the actual large hospital. But I think it was a very rewarding experience. And after that, then I was more involved in management, and I actually spent some time for my sins as the associate clinical director for medicine, emergency medicine directorate. So I was involved in various different things, including obviously increasing the number of NCHG staffing, trying to redo the rota in a way which will align our teams, which was dismantled by EWCD and so on. We try to put forward proposals and still work in progress for electronic performance, for records and so on, and then working with patient flow and clinical handover, try to ensure safe patient journey throughout the hospital in their time here. So I suppose I'm also very privileged that even within RCSI, I have a small role to play, a modest role to play, to help with various working groups. I was involved with the feedback feed forward working group, the peer observation teaching, and then more recently in the curriculum reform with THEP. And you know, it was a good exercise to be able to, you know, look at phase 1 and phase 2 being developed, have opportunity to review it first, and then to add in my comments for what's worth to see that the curriculum will be an outstanding, excellent curriculum for all the students in RCSI, both here and globally, internationally. So to conclude with, I just want to also thank my colleagues here, in particular Professor Seamus Treenan, who has given me ample opportunities to work within the department, within hospital, and also within the RCSI in the Graduate Entry Medicine program and other places. And I suppose, thank you also for listening to me for the time, and we might get to meet in person whenever the opportunity arises. Thank you very much. Enjoy the rest of the alumni sessions and the gathering. Take care.